Welcome to Hot Health, a program that brings you current information on a variety of health topics that may impact your life. Today we have Dr. Ruth Stanheiser and special guest Dr. Ella Haddad, who will be presenting on the topic of vitamin B12 right here on Smart Lifestyle TV, an LLBN network.
Good evening, Dr. Haddad. It's wonderful that you're going to be our guest this evening on Hot Health and going to be speaking to us about vitamin B12. Can you tell me a little bit about your background?
Well, I'm a teacher. I teach at the School of Public Health, nutrition, and related topics.
So you can present on a variety of topics. Maybe we'll have to have you back for some other topic. But this evening it's B12. Now I hear an accent. Were you born in the United States?
No, I was born in Baghdad in Iraq, so that's pretty far away.
And how many years have you been teaching at the School of Health?
I think about 30 years, but I've also taught overseas in Beirut, Lebanon, at the college over there.
So we're going to be hearing tonight about B12, is that right?
That is correct.
Okay.
So I'd like to talk tonight about whether people are getting enough vitamin B12. Now, we've known all along that vegetarians and people who don't eat a lot of animal foods, meat, milk, eggs, might not get enough vitamin B12.
So are you saying that you can only get B12 from animal products?
That's correct. But the hot topic is the fact that in the last few years, they've discovered that people who are older, like over 50 years of age.
Well, that's not old anymore.
That's not old anymore. But older people may also have a problem absorbing vitamin B12, even though they eat animal foods. They eat foods that contain vitamin B12. And it's estimated that maybe 1 in 5 of people over the age of 50 might have a problem with vitamin B12 absorption, even though they eat meat and dairy products, sources that might contain vitamin B12. And the reason why this is so is complex a bit, because vitamin B12 is a complex vitamin. I have the...
And complex means complicated, right?
Complicated, that's right.
Okay.
I have the structure of B12, and you can see it's quite a huge structure, and I'm comparing it to vitamin C, just a simple small molecule. We know we get vitamin C from oranges and some other fruits and vegetables, but B12 is not made by any plant or animal.
Oh.
Yeah, it's quite an interesting vitamin, because we depend on plants for most of our nutrients. And one of the exceptions is vitamin B12. B12 is made by bacteria. So whether we're human or cows or whatever we are, all of God's creatures depend on bacteria for vitamin B12. And we've got bacteria in our large colon. You can see it there in the picture. The bacteria in our colon does make vitamin B12, but it isn't absorbed because it cannot be absorbed from the colon. It has to be absorbed from the small intestines. That's where it gets absorbed.
So in the first part of the bowel?
In the first part of the bowel, yeah. And the cows, because of their wonderful four-pouch stomach, their ruminant stomach, the bacteria there makes B12, and it gets absorbed into the cow's milk and the cow's meat. The same way with chicken and fish. But our bacteria is too far down, and we cannot absorb the bacteria that our colon makes. So we cannot absorb the B12 that our colon makes. So we have to depend on either animal sources or synthetic sources, on supplements. Now, vitamin B12 absorption is quite complicated, and this looks like a very complicated picture. But do you see the stomach over there?
I can see the stomach.
Yeah, the stomach produces gastric acid. It also produces other components that are very important for the absorption of B12, even though B12 that we eat, for the food that we eat, gets attached to all kinds of components, and then it is absorbed in the small intestine, okay? And, why is it, like I said, that B12 is poorly absorbed by older adults? Because when B12 comes from fish or meat or eggs or milk, it is attached to protein. And as we get older, I guess our stomach makes less acid and less some of the important components that detach the protein from the B12. So the B12 stays stuck to the protein and doesn't get attached to something they call intrinsic factor that's very important for its absorption.
And that intrinsic factor is made at the very end of the small bowel, is that correct?
That's where it gets absorbed.
Oh, that's where it gets absorbed.
Yeah, the intrinsic factor comes from the stomach.
I got it.
Okay, and the stomach acid helps separate the B12 from the protein to which it's attached, and then it can get attached to the intrinsic factor, which gets absorbed in the small intestine. But as we get older, there's thinning of the lining of the stomach. They call that atrophic gastritis. And that makes it harder for people to separate the B12 from the protein. And so it doesn't absorb so well in older people. But, older people can still absorb B12 from supplements because that one is not attached to protein. Okay? So we said older people are at risk for not getting enough B12, but who else? Of course, we know vegetarians and vegans because they don't get a source. And people who have had weight loss surgery. So they cut part of the stomach, they don't produce enough acid, so they can't detach B12, so they have an absorption, a problem with absorbing it. Also, people who have things like Crohn's disease, they have, or celiac disease, they might not be absorbing as well. People who have pernicious anemia, that's a terribly serious condition because those people have an autoimmune antagonism to the intrinsic factor. So they fight their intrinsic factor, so they can't absorb B12 from food. And I put on there on the slide a special consideration for people who are pregnant and breastfeeding. Because moms need more B12, they need it from themselves and they need it for their babies. And sometimes even people who might be eating animal foods might not be getting enough vitamin B12. So pregnant women who are breastfeeding are especially vulnerable. I can remember a lady I saw a few years ago. She was breastfeeding her baby, but her baby could hardly lift up its head, and it was about 9 months old. And she was vegetarian, but she was drinking milk. But she wasn't getting enough vitamin B12 for her and her baby. And I'm glad she got treated. So this is something that we need to be aware of. Also, a hot topic is that many of the medications that are commonly used nowadays, especially by older people, also interfere with the way the stomach works and the absorption of B12, especially the antacids, things like Prilosec, but other antacids too. And then the commonly used anti-diabetic medication, metformin or glucophage, seems to interfere with how the body absorbs B12. So this is something that we have to
And
be
that's
aware.
a real hot topic because that's just been recognized in the last couple of years.
That is correct. And I'm sure you as a physician meet those situations.
Yes, the lowest ones that I have seen lately are on people who have been taking, they are not vegetarians, they are meat eaters.
Yeah,
But they have been on the diabetic medication, and it's a good medication,
yes.
but they are low in B12.
Because it interferes somehow with B12 absorption. Like we said earlier, B12 absorption is quite a complicated process. So lots of things can interfere with the process. Okay, so we talked a little bit about B12, but what really does it do in our bodies?
Yeah, why do we need it?
Why do we need it? Yeah, that big complicated formula. We need it to make red blood cells. So one of the early symptoms of deficiency would be anemia. But we also need it for our nerves. And we need it to make DNA. And you know, DNA is very, very important for life. We're constantly having to synthesize new DNA. So
For cell division, anything that's growing.
anything that's growing, yes. And you know, when people get deficient and they might have anemia, this is picked up quickly. But sometimes you get some nerve degeneration and without showing any anemia. So sometimes it's hard to pick up on people who might be deficient in vitamin B12. These are some of the more common symptoms. Tingling in the hands, legs, feet, difficulty walking, you know, walking with a staggered walk, balance problems. Sometimes people have changes on their tongue. And sometimes people even have cognitive changes, like memory loss, or a husband who was nice all of a sudden becomes aggressive. So those kinds of things might also be linked to vitamin deficiency, including vitamin B12 deficiency, as well as weakness, fatigue. Some people feel that as an early symptom.
Those are kind of non-specific.
Those are kind of non-specific, yes. So that's why we have to be aware of our diets and make sure that we are getting enough vitamin B12 in our diets. Now, for diagnosis, if a person has any of those symptoms and is thinking about possibly a deficiency, check with your healthcare provider, okay? The healthcare provider can do a blood test and see if there's anemia. It's interesting, the anemia of vitamin B12 deficiency, the red blood cells, instead of being too small, are too large. They're huge. So, but there's less red blood cells. The physician can do a blood level, concentration of B12. And probably one of the better tests is methylmalonic acid in the blood, but that usually is not done except to make sure if a person has a B12 deficiency or if that is something else going on with this person. And physicians can have a number of treatments. Sometimes they can give injections of B12. That way you bypass the absorption process. Or they can give B12 supplements, larger dose B12 supplements regularly helps enough B12 get absorbed.
My understanding is that it's very important to chew and not just swallow. I know that in our recent committee meetings, we had a big discussion about this.
Yes.
And there have been studies that show that absorption of B12 is much higher if it's chewed rather than swallowing it with some water or something like that.
That's correct, because there's a factor in saliva that also helps the absorption of B12. Also, probably if you're really deficient and you want to bring your levels up, to take it more often than just once a day. Okay, so what can we do to prevent the conditions? Okay, so first of all, are we vegetarian? Are we eating very little meat, dairy, or eggs in younger persons? then
Who are growing.
who are growing, yeah. So making sure we're getting enough quantities of vitamin B12. Look at the diet. Maybe write down what you eat usually. See if there are any sources for B12 in the diet. Are you taking any supplements? And then especially if you are 50 years or older, you really should have a source. Even if you're not vegetarian, you should have a supplemental source. A supplement, they call that free vitamin B12. It's free because it's not attached to the protein. That's why it's called free vitamin B12. So this is a slide to try to show us how much we need every day. So the recommended requirement for here in the US is 2.4 micrograms per day. So microgram is a very small amount.
That's a thousandth of a gram.
That's a thousandth of a milligram.
Of a milligram, yes.
A milligram. So if you take the tip of your knife and try to pick up a few kernels of salt, that is probably a milligram, and that's a thousandth of it. So it's really a very, very small amount, but it's a very important amount. The daily value is what they use for this nutrition label, for the nutrition facts label. So when you read on the label that a serving of a food contains 50% of the daily value, you will know it contains 3 milligrams. If it's 100% of the daily value, it will contain 6 micrograms. Sorry, they're
micrograms.
Micrograms, yeah. So the daily value is a simple way for people to help understand,
how much they're getting enough.
If they're getting enough. So on the slide, if we start out from the bottom of the slide, we'll see 1 serving of salmon, 3 ounces is, the usual serving, contains about 5.4 micrograms. So salmon is one of the higher sources of vitamin B12. Beef, a 3-ounce portion would be 1.4 micrograms. Chicken has the least, 0.3 micrograms. 1 egg has about 0.6. 1 cup of milk has about 1.2 micrograms. So 2 cups of milk or a cup of milk and yogurt should give you your requirement for the day.
Unless you have some reason that you need more.
That you're not absorbing properly. Breakfast cereals are fortified foods. That means they have B12 added to them. So some breakfast cereals might have, all 6 micrograms, the whole daily value per serving. So foods that are usually have B12 added to them, the fortified foods, the ones that have the free vitamin B12 that isn't attached to a protein, are usually some breakfast cereals, also some milk alternatives, okay? But not all of them. My friend here was just telling me that she was reading the labels and almond milk did not have any B12 added to it. Whereas some brands of soy milks do have. And some brands of almond milk may have vitamin B12 added to them. So you must read the label. You'll hear this from nutritionists a lot. Read the label. And especially important to read the label if you want to get adequate vitamin B12. B12 is also added to some meat alternatives, things like linguettes or other, what we call veggie meats or fake meats. But here too, it's important to read the label. And of course, there's supplements. We can take it as pills, sublingual tablets, as you were saying, that can be chewed. Some people like to take it as drugs. Multivitamins may have B12 or they might not. So again, read the label. And the form of vitamin B12 that you will see on a supplement, it will say either cyanocobalamin or methylcobalamin. Both of these are available on the market nowadays. Cyanocobalamin is usually used by the food industry to add it to the foods. Methylcobalamin is something that is more popular now because some people think it is better, but I think both of them are equally good.
So the cyanocobalamin
Yes.
is safe.
Yes, it's safe.
And in my reading, I have understood that a number of people in the United States, it's kind of, I think this is where this came from, they actually can't make methylcobalamin from cyanocobalamin. There's an enzyme needed there.
That's right.
But I haven't been telling my patients to take it because most people can get what they need with the cyanocobalamin.
That is correct. Some people might have a genetic problem and need to take the methylcobalamin.
Right.
And it's interesting that absorption from supplements isn't that great, but the amount in supplements is high. So if we're taking 1 microgram, for example, we'll absorb half a microgram. If we take somewhere between 10 to 50 micrograms, we'll absorb about 1.5 micrograms. But if we take 500 micrograms, we'll absorb about 10 micrograms. And if we're taking 1,000 micrograms, then we will absorb about 13 micrograms. So the percent absorbed is lower as the dose goes up, but of course the amount absorbed will be higher. Yeah. So for people who really need to bring up the vitamin B12 levels in the blood, it's better to take like 500 micrograms maybe twice a day than a whopping dose just once in a while.
Okay.
Yeah, that would make more sense for the efficiency of absorption. And something we mustn't forget is that there are fake forms of vitamin B12. These fake forms are found in seaweed, and because you hear people saying, oh, I get my vitamin B12 from seaweed, or I buy the spirulina, or some fermented food like natto. There is vitamin B12 in these foods, but they're the fake vitamin B12 that doesn't do us any good.
So we can't absorb it?
We absorb it, but it fights with the good one for the receptors.
So it's a real fake.
Yeah, it's really fake. So we don't want to go there. One food source that I have forgotten to mention is something called nutritional yeast. Because nutritional yeast is prepared on a vitamin-rich medium, it does contain vitamin B12. So nutritional yeast is also a nice way for people to, as a source of vitamin B12, because a lot of people like to add it to their cereal and other foods, and it doesn't seem like a supplement or something artificial. Okay, so in conclusion, we can say that people who have to watch their vitamin B12 are especially vegetarians and people who eat small amounts of animal foods. So they might not be 100% vegetarians, but if you're eating too little, you might not be getting enough, okay? Anyone who has any absorption, intestinal problem might be at risk. Also, like we said, older people, because they cannot separate the B12 from animal foods from the protein to which it's attached. So the way to prevent is to make sure that we get a source of vitamin B12 every day, either from a a fortified food like nutritional yeast or fortified milk alternate or breakfast cereal, or take a vitamin B12 supplement regularly.
So I have a question for you.
Okay?
We have a couple of minutes left here.
Okay.
My understanding is that we have stores of B12, and it takes quite a while for those to disappear. Is that true?
That's pretty much true, but not in every case, because I've read cases in the literature where people might have developed deficits in months or days. So for most people, their stores will be helpful over time. So you might not see a deficit right away.
So you might have to take more metformin for a longer time before it's noticed that it's going down in your bloodstream.
That is correct. But it could happen quickly because not everybody is the same. Not everybody might have the same stores. Not everybody might be able to maintain it in their body as long. So
is there an optimal level of B12 in your serum?
Usually doctors, which you should know, physicians use a cutoff point of about 200 picograms per mil. 200 picograms per mil.
So that's what we call it deficient when it gets down there. So I'm asking, is there an optimal level?
The optimal will be higher than that.
Yes.
Because people between 200 and 400 could be borderline deficient, and you don't want to be there.
Yes, I've read a study that showed that if you were in the lowest quintile, they divided it into fifths. If you were in the lowest quintile and used very sophisticated testing, and then supplemented those people, that those people in the lowest quintile were already having some cognitive decline. So I happen to think that it should be higher, maybe 400, 450.
Yeah. And even though you can reverse maybe the anemia with supplements, very often if you have nerve changes or cognitive decline, it might not be reversible once you start supplementing. You might be able to stop it, but you might not be able to reverse it.
And I wanted to mention that that is one of the things we check when somebody comes into us with cognitive decline. We always try to check the B12 level because potentially there is some reversibility to that.
Okay.
Thank you so much, Dr. Haddad, for bringing this hot topic to hot health.
We want to thank Dr. Ruth Standheiser and Dr. Ella Haddad for sharing with us on the topic of vitamin B12, what it does, where it's from, even what free vitamin B12 means, and also the medications that can affect vitamin B12. We hope that you enjoyed this episode, and go ahead and go to our website for more information at www.smartlifestyletv.com.